Okay, well, let's go ahead and get started. Welcome, everyone, to the National Association of Environmental Medicine webinar series. We're really happy to have you here tonight. If you're joining us again, welcome back, and we're going to keep doing these for you. Such valuable information. If this is your first time, welcome. And if you're not a member of the National Association of Environmental Medicine, please join us. We're such a valuable resource, and it's just really hard to practice medicine these days without considering the impact of environmental toxins on our health. So today, our topic is aerotoxic syndrome, and I'm sure that probably you have flown somewhere before, or maybe you fly more regularly for travel or for business. I know that we haven't been flying as much over the past year, but I know that will change again soon. And we do need to know about this very important topic. It was actually quite a surprise to me. And for anyone that flies, it's something very, very important to know. So welcome, Dr. Lynn Patrick and Cathy Cohn, nutrition expert. We're really excited to have you tonight, and I'm going to let you take over. Just a few things. We will have time for questions and answers at the end. So if you have any questions, just please post them in the Q&A section. And when Dr. Patrick and Cathy are done with the presentation, we'll be sure to get to your questions. So go ahead. I think, Cathy, you're starting.
All right. Well, aerotoxic syndrome simply is the potential endpoint from incidental fume events during air travel. And I'm going to detail that. But first, how I came to even have this on my radar, safe radar, that is. 2 years ago, I traveled from West Coast to New York, visit my older uncle, and I sat down next to a woman in my seat, and I felt I had to warn her that I wasn't the best traveler to be sitting next to, because I didn't really enjoy flying. And at that point, she introduced me to a further concern around flying. I don't think that was her point, but in our conversation, it came up that she had a daughter who was a flight attendant, and that she had been made ill by a fume event and had to take a number of months off of work, but ultimately went back to work even though she wasn't feeling so well. And she gave me the heads up that if I were to notice a smell of stinky socks when I was boarding a plane, to go the other direction. Now, of course, that's the only opportunity you have to get off a plane, but these events sometimes can actually occur before takeoff. And so what is a fume event? Actually, I want to backtrack a second and just say, I'm going backwards. Sorry, folks. That I had never heard about this before, despite being a student of environmental health. And the risk of toxic exposures to passengers and especially flight crew became apparent, and what this really means to air travel safety in general. But also as practitioners, this should be something that we're aware of per associated symptom sets and occupational background when we're working with our clients or patients. These are useful clues when toxic burden is suspected or you may have a complex case. And so when I got home, the first thing I did, Lynn, was reach out to you because I wanted to know what you knew about fume events.
Right, right. And I think, Cathy, I'll just tell a quick story. I had the great good fortune to work with a wonderful, brilliant clinician, Dr. Michael Gray, who's located in Benson, Arizona. We worked together for a little bit, probably about 20, 30 years ago. And he had an environmental medicine practice in Benson, Arizona, which is a balmy place outside of Tucson. And his clinic was on the news because at any one time he had about 10 or 15 airline personnel camped out in the local park near his clinic because they were so chemically sensitive and so sick, they could no longer handle being exposed to the common indoor air exposures of fumes and phthalates and everything that everybody's exposed to. So they literally had to live outside. And he was actually able to start treating these patients. And it was the very beginning of my environmental medicine practice when I first started to understand who the sick folks were. And that's when I started to understand that airline personnel have a high percentage of them, the airline industry has a high percentage of airline personnel who fly a lot, who become multiply chemically sensitive and disabled. And this is the reason why.
Thank you, Lynn. And that's a really compelling background for you. Some details about fume events. They're caused by unpredictable breaches in the aircraft's bleed air system, resulting in toxic contaminated air pumped right into the cabin and the cockpit. Most often this is identified, as I mentioned, by a particular unpleasant odor and/or smoke. However, these events can also be odorless, and some symptoms of exposure might be mistaken for jet lag. Additionally, the exposure can cause immediate and acute symptoms, but also chronic and sometimes irreversible, disabling health conditions and even death. And so digging into the history of this, most jet engines use a bleed air system for several purposes, including pressurizing and conditioning the air into the cabins. However, this bleed air can become contaminated if and when heated synthetic oil and hydraulic fluid leak through a faulty seal, allowing it to enter the cabin. This can occur while the plane is on the ground at 0 altitude or anytime during travel, including landing. And awareness of this issue, however, dates all the way back to 1953, when this was first introduced. And also around this period, it was found that an internal study on what Boeing called the air contamination problem discussed the need for filters to purify cabin air. So back then, they knew there was a problem. And we're going to call this, as others have, the airline's dirty little secret, but you can invite the regulators and the manufacturers into this group. Basically, what we're working with is 50% of our air in the cabin comes from this bleed air, and 50% is recycled. Unfortunately, bleed air is not filtered. And Dr. Susan Michaelis, who's a former pilot and a trained air accident investigator who's worked with the aviation industry on air quality and proactive safety, had a lot to share around this. She's done studies, and here's a couple of examples of that, finding that aircraft air does not meet standards required by the FAA and the CAA. And she also published 2 studies showing a repeated pattern of acute and chronic adverse effects, 87% of which could be related to oil leakage. There's no routine monitoring for air quality or contaminants on commercial aircraft. And additionally, ESA, which is the European Union's Aviation Safety Association, they detected air pollution in the cabin, which included formaldehyde, ammonia, carbon monoxide, organophosphates, which are stars in this camp of fume events, benzene, hexene, VOCs, and pesticide residue. So there's a long history of this, of dangerous fume events. And unfortunately, part of the reason why this is ongoing is, or primary reason, is the denial that we have safety issues around cabin air by the 3 main players: airlines, regulators, and the manufacturers. Publicly, we don't get any issue. We get assurances that there's no air quality issues, but internally, it's been found to be a different story within the industry. And these inconsistencies also apply to what the regulators say. In December, the LA Times did a really deep dive investigative story about fume events, which I'm calling some data from in my conversation around this topic. And their research included a review of thousands of pages of court records from workers' comp cases and litigation against the airlines and the manufacturers. And within this, we found some interesting information. Boeing has decided against developing any technology to install air sensors despite a request from the airlines. But more telling, in a 2018 deposition, a senior Boeing engineer acknowledged that there were internal concerns that data from sensors could be damaging in lawsuits brought by sick passengers and crews against the company. And in a much earlier email, 2008, the same engineer wrote, "The biggest impeding factor is legal issues." Meanwhile, Boeing has stated that scientific studies have not proven a link between fume events and health problems, and that the inside of Boeing airplanes is safe. But back to some of this data from the LA Times report, Boeing warned its own workers in a safety advisory that engine oil fumes may damage the nervous system and cause symptoms like dizziness and headache. So that is some of what's been going on behind the scenes. And when we're looking at the frequency of fume events, this is concerning, and there's lots of documentation around this. The Allied Pilots Association has cited that there's as many as 20,000 fume incidents over the past decade, while the University of Kansas did their own study, finding more or less an equivalent of 5 events a day in the US alone. However, some researchers, Winder, Balloway, in a study they did, they found more than 300 reported events on flights annually, with 40,000 passengers and crew being exposed. Also in this LA Times article, the same senior Boeing engineer had expressed concern over the frequency of their 757s being diverted every 2 weeks due to engine seals leaking so much oil that the crews complained of blue smoke thick enough that the flight attendants couldn't see halfway down the aisle. He also said, "Given the number of events for the 757s, I would have thought that the FAA would have forced the issue." Well, force they didn't. And a few more notes on the frequency of this. Issa told the BBC, who also had done an article on fume events, that there were more than 100 serious fume events between 2017 and 2018. The FAA, another regulatory body, had concluded that underreporting of fume events is endemic after they had studied air contamination events. A little more data. An analysis of NASA safety records identified 362 fume events involving nearly 400 pilots, flight attendants, and passengers in a 2-year period. In this group, 73 of the flights required emergency oxygen. 48 pilots were described as impaired to the point of not being able to perform their job. And there's no requirement for airlines to inform passengers when there's a fume event or what they were exposed to. So about this time, you must be assessing your own risk and thinking about, the next time you might get on a plane. Here is one of the most chronicled examples of a fume event that happened in 2007, because as you're thinking, cabin air could be a risky business. This particular one was so documented in a film called Welcome Aboard Toxic Airlines that was produced by a former pilot. So this, what we're describing as aerotoxic syndrome, it is a occupational, but also consumer risk. Okay, risk. And it's a term that was coined about 20 years ago by Chris Winder and Jean-Christophe Balloway, described as exposures to hazardous operational aircraft materials such as engine oil vapors and hydraulic fluid of significant toxicity can produce short-term intense or long-term low-level illness and related symptoms, largely through inhalation. And they detailed this further. They highlighted that it largely affects the central nervous system. It may be reversible in brief exposure. Otherwise, permanent injury or chronic illness or death could occur. There are 8 EU doctors who have a diagnosis for aerotoxic syndrome despite the industry's denial of the illness. And passengers have also experienced acute and severe poisonings from a single episode. Health effects from events are largely neurological, but also cross various systems and are often disabling in degree. The most common symptoms you hear being described are dizziness, disorientation, confusion, memory and concentration issues, cognitive problems, fatigue, breathing difficulties, irritation to eyes, nose, or throat, headache, blurry vision, numbness, vertigo, impaired coordination, mood issues, and sometimes there's a loss of consciousness, which becomes especially concerning if it affects a pilot. Long-term health effects are fairly similar, but they can be life-changing. And they also involve suppressed immunity, pain syndromes, and cancer might be added to the list you've already heard about. And this label tells it all. It's got its own warning. It contains tricresyl phosphate. Don't swallow this product because it can cause nervous system disorders, including paralysis or prolonged breathing of oil mist or prolonged repeated skin contact. These can cause nervous system effects. And as you can appreciate, genetic variants can set the stage for different people having different effects. And additionally, they may also have a harder time detoxifying organic phosphates in between flights is one of the thoughts as far as how this might develop. So TCP is tricresyl phosphate. It is the most notorious of the organophosphates that might occur in a fume event, but in their same family, there are other cresyl phosphates that as isomers are actually more toxic than TCP. These are added to jet engine oil and hydraulic fluids as flame retardants and anti-wear chemicals. And TCP is not an unknown toxin. It was used as a nerve gas in World War II. Other contaminants include a range of VOCs and carbon monoxide, aldehydes, aromatic hydrocarbons, and more. And how these health effects may manifest are going to be different depending on each individual's background factors of other toxic environmental exposures. On to you, Lynn.
Thank you, Cathy. So I'm Lynn Patrick. For those of you that don't know me, I'm the current past president of NAEM and have spoken. I've done a bunch of lectures here, and I'm going to refer to a couple of them that are archived in the webinar archives for NAEM, because this really is an opportunity to understand the mechanisms for a bunch of different chemicals. This is really a toxic cocktail, as Cathy has made so clear. It's not just any one chemical that is causing the problem, even though TCP has been identified as the chemical. And we'll talk about that. And before I start, I just want to say that I have had my own fume event as I boarded a plane, a little tiny plane out of Durango, Colorado airport one early cold winter morning. They had left the door open for boarding, and they were fueling the plane at the same time that they were boarding it, which I don't think they were supposed to do, but they were doing it. And there was a phenomenon of bleed air coming into the plane, but also the fuel fumes were coming into the plane at the same time. And as you can imagine, it was not good. The masks dropped and people were coughing and got very sick, and I got very sick after that. But fortunately, I was at a conference where I had access to a sauna. So we'll talk a little bit about treatment, as I'm sure you're all now very interested in. But anyway, TCP, triocresyl phosphate. It is an organophosphate chemical. We'll talk a lot more about it. You can see its chemical structure here. The important part of this slide is that it cannot be treated by the current drugs that are used to treat organophosphate pesticide poisoning. It does not work. And I'll talk a little bit more about that next slide.
And so now we're taking a wide angle lens into air travel safety and how it's actually truly in the balance, particularly if it may be affecting pilots who can become incapacitated. And there is many cases where this has actually happened. 2019 fume event that occurred while waiting for takeoff. The plane returned to the gate. Passengers saw both pilots and 4 flight attendants removed in wheelchairs. And the pilot described feeling increasingly confused, drunk, had difficulty concentrating and forming thoughts and speech. And the entire crew was then brought to a nearby emergency room. Well, several passengers who witnessed this asked what they were exposed to, and they were told by the airlines, who happened to have been Southwest, that the smell was rotten jackfruit brought on board. When the LA Times inquired of this to Southwest, they maintained that the fruit was to blame, and they also wouldn't comment on the captain's safety report made to the NSA. And another emergency, to my hometown with British Air, pilots issuing a pan-pan. And in the confidential report, a crew member described the condition of the crew, all these various symptoms. 12 of the crew were noted as cause for concern. 8 crew were needing to be on oxygen. Some seemed spaced out, others slow to respond. And it was discussed amongst the crew what they were going to do on landing, because they weren't sure how they were going to manage the doors. So many of the crew had been impaired. In 2019, another British Air flight, both pilots nearly incapacitated, admitted to hospital on landing. 2020, a BA co-pilot became unresponsive at controls during a landing at Heathrow. The captain issued a mayday call due to the fume event. They were just 7 miles away to landing, and was able to put on an oxygen mask and land. Now, the BBC, who, as I mentioned, had done a report on fume events, saw the air safety report linked to this, and in it, they found that British Air had threatened staff with disciplinary action or possibly firing if they revealed the contents of confidential reports. However, one of them did risk it, feeling it was just too important to let the truth be known. And that leads us into what we'll call industry intimidation. Crews are fearful of speaking out due to company retaliation, possible threat of job loss. And Susan Michaelis, in an interview with ABC News, also said that pilots who report such problems might be downgraded or not promoted. And so this really demonstrates how these events are unreported for various reasons. In 2018, a San Francisco TV station for CBS happened to obtain an audio clip of a recent Alaska Airlines conference call in which employees were warned to keep all discussion of fumes private. Quote, "We have a very strict social media policy. We will investigate those instances where people do not abide by the policy and the infraction can lead to termination. So please keep that in mind." On to you, Lynn.
Okay, so medical perspectives. And again, we want to talk about this from the perspective of being a healthcare provider and seeing either a retired former airline personnel or someone who is currently exposed. So of course, one of the best people to talk to about this would be somebody who is either a former airline pilot or who does the medical exams, the flight exams for the FAA. So this is Dr. Michael Mulder, who is both. He spent 10 years looking at aerotoxic syndrome. He actually did some autopsies on some personnel who had basically, done thousands of hours in the sky, and all of them had evidence of neurodegenerative damage, both to the central and peripheral nervous system, as well as the heart. He published in the area of catecholamine-mediated myocarditis, which, is a combination of exposure to both solvents and organophosphate pesticides. But in this specific instance, and from his research, he's blaming the organophosphates. And we know that from some of the research on farmers that are exposed to organophosphate pesticides, that we also find, and sprayers, we also find this in them, that long-term exposure to organophosphates, it's not going to happen just in the beginning or with one or two exposures. It's really long-term exposure does cause myocarditis. And so the pathology here is the same, even though the organophosphates are being used for two different purposes. So the mechanism here is the inhibition of enzymes that we know from medical school, right, that organophosphate pesticides are toxic because they cause the inhibition of acetylcholinesterase and butyrylcholinesterase, other cholinesterases, and I'm going to talk about this in more detail. But that basically there's a very high mortality rate related to this catecholamine-mediated myocarditis. And at least from his perspective, go back for just a second, it is absolutely related to this exposure to bleed air. And that's the publication on ResearchGate down there. You can actually access it. Go ahead. The head of UCSF's Occupational Health Clinic, Robert Harrison, has also seen a lot of airline personnel. He's also seen passengers who've been exposed to single fume events, which, as we all know in environmental medicine, right, the problem is not just one event, it's that one event pushes you over the edge. The barrel starts overflowing, so to speak, that your history of exposures and your body burden are such that you can function until that last event, which for many people, I think these single fume events are the events that push them over the edge. So he's seen over 100 patients. He believes that this is real and that the symptoms are connected to the exposure. And he includes in there central nervous system encephalitis, reactive airway lung dysfunction, central nervous system damage, multiple chemical sensitivity, loss of tolerance, and basal cell carcinoma, interestingly enough. Next slide. So this pathology of organophosphates means that when you don't have any acetylcholinesterase, you've got too much acetylcholine, obviously. And this is what happens in acute organophosphate poisoning. This is what happens when, and this happens in hundreds of thousands of farmers, unfortunately, in India and other parts of the world who commit suicide by swallowing organophosphate pesticide powder. They get respiratory muscle paralysis. In that process, though, they also get central nervous system toxicity, right? Confusion, slurred speech, convulsions, coma, all of that well-known symptoms of acute organophosphate pesticide toxicity. So this can also happen with the tricresyl phosphate and dicresyl phosphate fume event exposures to the degree that they can cause actual cardiovascular events.
And so we'll pick up with some cases, very tragic cases, and probably some of the ones that have gotten the most media exposure. Matt Bass was a young crew member on British Airs, and he had obviously met a fume event. He was unwell for months, was having weight loss, digestive and respiratory issues, and severe fatigue, and he died in his sleep. The initial post-mortem report did not indicate anything out of the ordinary. His parents were very concerned about what really underlay this, because they knew what he was going through prior to his death. And he was a young man, and they requested a second post-mortem report where high levels of organophosphate poisoning were found. And a woman named Dee Passon was so concerned about how many airline crew had died, she created a list called the Angel Fleet. And Matt Bass was one of the inspirations for that. Two other cases in 2009, both British airline pilots, Karen Lysakowska and Richard Westgate. They were both 43 when they died. They died within a few days of each other, amazingly. And while Westgate was shown to have his death being attributed to accidental sleeping pill overdose, his postmortem also showed damage to his heart and nervous system. And one more note on his story, because there was a UK investigation into Richard Westgate's death several years later, and the coroner who did this wrote a report to prevent future deaths. He sent this to British Air's and CAA's CEOs. His concerns: organophosphate components present in cabin air. There is no monitoring. Occupants of aircraft cabin are exposed to these compounds. There is no consideration of genetic differences, and health problems of those who control the aircraft could lead to the death of its occupants. And that really sums up why we should care about aerotoxic syndrome and what creates it. There's also been some additional occupational and passenger exposures worth noting. In particular, toxic materials intentionally used inside the cabin can include flame retardants like those used on fabric, and also insecticides. There are certain destinations where pesticide spraying while passengers are on board is essentially required. Well, the spraying is required, and they don't seem to mind passengers being on board. As far as occupational exposures, for the past about 10 years, there's been new uniforms causing thousands upon thousands of airline crew, both ground crew and flight crew, to become ill and have symptoms related to the toxicity of their uniforms. Harvard did a study on the Alaska airline uniforms that were manufactured by Twin Hill Garments, and they found, their findings were that irritant and allergic compounds were in some of the uniforms, that they could cause skin symptoms. And this was the most important part of their finding, was that evidence, they cited evidence that exposure to low levels of chemicals and chemical mixtures in textiles can cause symptoms. So that was kind of a breakthrough in itself, because these kind of challenges, when there's reason to bring it to the attention of companies and manufacturers, are usually just kind of written off as there's no basis for connecting these dots. Not long after that, American Airlines had their own problem when they introduced new uniforms, the same manufacturer, and their employees claimed that the toxins were causing health problems. There were thousands of people affected here as well. And then in 2020, Delta rolled out some high-tech, high-performance, very colorful uniforms by a famous designer that also caused reactions from hair loss to rashes. And there were, the compounds were actually identified in this particular uniform. They were immunotoxic and carcinogenic. And on to you, Lynn.
Thanks. I just, I have so many questions for you, Cathy, but we'll wait till we get to the Q&A. So back to a little bit about the toxicity of these compounds. So as you probably have already figured out, the organophosphates are a big part of this. Tricresyl phosphate is very commonly used. It's been identified. It's found in up to 100% of air samples. And as we've already spoken about, it's neurotoxic, causes degeneration, can cause paralysis. And historically, I think this was interesting. One of the reasons that prohibition may not have been such a good idea is that tricresyl phosphate, and remember, these organophosphates have been around for a long, long time, contaminated a bunch of ginger beer and led to the paralysis of up to potentially 50,000 people as a result of, for some reason, I don't know if it was intentional or an actual unintentional contamination, but it was found in the ginger beer. So a couple of times, let's go back for just a sec.
Okay, and when should I share?
I beg your pardon?
Okay, go ahead.
A couple of times we've talked about genetics, and I want to refer to some of the information I presented in a past webinar on pesticides, because this is really, really important. Everybody that you see that you think or suspect has had an organophosphate exposure, you should check for the PON1, peroxidase 1 SNP. Cathy already knows about that. She's nodding her head, because these are the canaries in the coal mine, because PON1, peroxidase 1, is the main enzyme that's used to detoxify the organophosphate. Flame retardants and pesticides and degreasing, lubricant, whatever organophosphate it is, your body breaks it down using peroxidase 1. So if you have a SNP in that enzyme, it's already been documented. There have been loads of studies on this. You are very, very much paralyzed, basically, in your ability to break down these organophosphate compounds. Of course, based on the SNP, there's two main SNPs. If you've got both of them, if you're heterozygous for both of them, even small amounts of organophosphate exposure can lead to all of these neurotoxicity symptoms. So just remember, PON1 is important. It is reported in almost every single one of the genomics tests, so it's very easy to extract. And I know that Bob Miller absolutely checks for PON1 and reports for PON1 SNPs, as do most of the other nutrigenomics tests. Okay. So the thing about these organophosphate compounds is that they don't just deactivate acetylcholinesterase. That's what we learn in medical school, right? But that's really the tip of the iceberg. So for example, serine hydrolase, it's a super family. There's 200 different serine hydrolase enzymes. That's only one target of tricresyl phosphate. These enzymes are found in the liver, in the brain, in the lungs. They have a variety of different purposes. They're lipases, phosphorylases. They basically underlie a lot of biochemistry. Butyrylcholinesterase, that's the enzyme that actually detoxifies tricresyl phosphate. So if the enzyme you're using to detoxify the organophosphate is deactivated, you're in big trouble, right? So as do all of the other organophosphates, tricresyl phosphate damages mitochondria. And that's what is underlying all the nerve damage. But the other thing that happens with organophosphates is that they, in their detoxification, you make a tremendous amount of reactive oxygen species, which will upregulate 8-hydroxydeoxyguanosine, which is, of course, one of the markers for oxidative damage. It's not just high in organophosphate exposure, of course. Many other toxicants like mercury, air pollution even will drive up 8-OHDG, but it is one of the toxicants that will definitely lead to elevated 8-OHDG. So this is how organophosphates lead to inflammation, especially of the central nervous system, leading to all kinds of symptoms, is through this mitochondrial toxicity and increased production of oxidative species, leading to oxidative damage. So the other part of this wonderful cocktail of polluted cabin air is volatile organic compounds, otherwise known as solvents, right? So when jet fuel gets burned, what comes out of the tail of what comes out of the exhaust of the airplane is actually hexane, isopentane, and 2-methylpentane. And I've seen this in high levels in the blood of people who live underneath flight paths, specifically flight paths of major airports. They're breathing this stuff. So for sure, you're going to find it in the blood of those who've been exposed to bleed air inside the airplane because it's a very confined space, right? Now, hopefully we will break these solvents down into, basically organic acids and urinate them away if our detoxification systems are working properly. So at the end of this presentation, we're going to talk about action steps for you, for your patients, for those that are exposed to this bleed air and have been exposed to fume events. But breaking down solvents and solvent detoxification is a big, big part of it. The other part, and Cathy already talked about this, are pesticides. And I want to tell you a story that will help you remember this. This is very important. On many flights from Africa and Southeast Asia, they're not allowed to deplane at the other end of the flight, wherever it is, unless they have sprayed the cabin and its contents, including everyone aboard, with 2% permethrin or phenolphthalein, which is another type of pyrethroid pesticide. Now, this is kind of a delousing, if you will, of the inhabitants of the airplanes. And these are agreements between different countries not wanting to spread vermin, so to speak, or infections from one country to the other. The problem is that pyrethroid pesticides are sensitizing agents. What that means is that they can, if you are exposed to them, you may then become sensitized so that the next time you're exposed to them, you will have a serious, and I'm talking about potential anaphylactic reaction. Or you may just have some histamine release that, is coughing or choking or having difficulty breathing. And there's a case that I present in some of my other lectures of a young woman who was a Peace Corps volunteer who on 2 flights, and only 2 flights out of Southeast Asia, was exposed to these pyrethroid pesticides. And then because that was her sensitizing event, at any other time that she was exposed to pyrethrins, like a dog flea collar, for example, she would have a severe anaphylactic reaction. Her face would swell, her eyes would swell shut. And this is not uncommon. And the allergists that have published on this have implored the airlines, the global airlines industry to stop using pyrethroids, to stop this practice, to have another way of, preventing the movement of bugs from one country to another. And there are many other ways to do that. Of course, there are many other ways to kill bugs without using neurotoxic pesticides. So how can we actually work patients up? There are a variety of ways to do that, and these are the suggested ways to actually document potential exposure to bleed air in fume events. Red blood cell acetylcholinesterase, the reason I put that on top is that is not a useful test because these engine oil additives don't have a major effect on acetylcholinesterase. They're much more able to deactivate butyrylcholinesterase. So the standard test that we use for organophosphate pesticide poisoning is not the test to use. It is useful to look at arterial carboxyhemoglobin because that's the standard test for carbon monoxide. And as you know, if you've treated a carbon monoxide poisoned patient, once that carbon monoxide binds to a red blood cell, it's there for the life of that red blood cell. So that arterial carboxyhemoglobin test will be positive for several months post-exposure. So tricresyl phosphate, the test for tricresyl phosphate is a butyryl cholinesterase assay, and that's the actual name of the test. It is the only lab test that proves exposure to TCP. And if someone needs to document that they were exposed to a bleed air event, that's the test that you want to do. The other test is called a neuropathy target esterase, but it's not as useful as a butyryl cholinesterase assay. So that really is the test that will lead to documenting that TCP is the exposure agent. It's also very helpful to look at blood levels of hexane, and as I mentioned before, isopentane and 2-methylpentane. Those levels may be elevated if the event happened recently. If it happened, months to a year ago, you're not going to see those solvents have already been broken down and eliminated through the urine. But if it's someone who is occupationally exposed, then their levels are probably constantly elevated, and it's important tests to do. We used to be able to do this test through Genova, the core panel, which is no longer available, but standard labs can run blood solvent levels, specifically these 3 solvents. And then finally, there's some evidence that people who've been airline personnel who've been exposed to bleed air have shown sensitivities to formaldehyde. So this is an antibody we're looking for. So the test is formaldehyde and glutaraldehyde antibodies, IgG, IgA, and IgM. So again, you're going to have that IgG antibody long after the initial exposure, but that can also be useful. And then other tests, we know that solvents are hematotoxic, so CBC, WBC. So especially hexane will lead to lowering of the production of both red and white cells, elevation of liver enzymes, including GGT, elevation of CPK with isoenzymes. Blood gas analysis is useful, and oxygen saturation testing is also useful because you're not getting the delivery of oxygen to the tissues, and blood oxygen is also going down. This is a test that illustrates, this is a blood test, and this is again from Genova, the core panel, illustrates someone who's been exposed to bleed air or who lives over the flight path of an airport. You can see the elevated hexane there down at number 7, and the 2 and 3 methylpentane as well. And because all of the other solvents, with the exception of toluene, which is barely up there, are very low, this would lead you to suspect either bleed air, or potentially isooctane is found in traffic-related air pollution. So probably a combination of the both of them. And of course, physical exam is really important. Whenever you've got anyone who is neurotoxic, you always want to look for the classic sign of the effect of solvents on the cerebellum, which is the inability to stand in a modified Romberg test with the eyes closed. And you also want to make sure when you do this test in sick patients that you are near them, because a lot of them, once they close their eyes, they cannot stand up. They totally lose their balance and they fall over. And then you want to do a complete neurological exam, as well as to assess mood and memory, because this neurotoxicity is both peripheral and central. And Dr. Stephanie Carter, who runs the Environmental Health Center Dallas, in Dallas, Texas. This was originally started by Dr. Bill Ray. It's an environmental health clinic. When I talked to her, she treats a lot of airline personnel and does a lot of testing and finds that they're all loaded with metals, solvents, and organophosphates. Of course, we can't do the Genova core panel anymore, but the GPL tox panel we can do. And we can find some of those toxic solvent metabolites in the urine and organophosphate metabolites in the urine as well. They also do provocative testing for metals with chelators at EHC Dallas. And I'm assuming that one of the reasons that these airline personnel are loaded with metals is that they don't have any glutathione and they cannot eliminate these metals. Their detoxification pathways are not working. They also do intradermal skin testing for a lot of the components we've just talked about, and they do find that these personnel are sensitive to the components via intradermal skin testing. For treatment, Dr. McCarter uses nutritional IVs, chelation for the metals, and in some cases, the oxime medicine 2S PAM, which that's why I put 3 asterisks there, is because tricresyl phosphate does not respond to the oximes. Preladoxime is the standard medicine that's used in treating acute organophosphate exposure, but it's not going to work in patients who have been exposed to TCP. She also has found that the nutritional IVs do help to eliminate the organophosphates, and that most of these folks have high venous blood gases and need oxygen therapy, which I'm not going to go into, but it is a therapy using high pressure oxygen to open up the capillaries and allow diffusion into the tissues. A lot of chemically sensitive and chemically burdened patients cannot oxygenate their tissues. This is just a simple technique to allow them to do that. So ICD-10s for aerotoxic syndrome are listed here. All of them have been used. The T codes, of course, are specific for toxic exposures. Treatment. N-acetylcysteine, curcumin, and melatonin have been used both in human trials and in preclinical animal trials. Specifically, I want to note that melatonin is now being used in acute organophosphate poisoning in India, where preladoxime is too expensive. It is critical, it's crucial in patients who have aerotoxic syndrome to optimize their glutathione. That can be done a number of different ways, but alpha lipoic acid specifically is effective in helping treat mitochondrial damage. And there is one study in animals that looked at pre-treating them with ALA and then exposing them to malathion, which is an organophosphate pesticide. Cathy, can you go back?
Yeah, that happened on its own, sorry.
That's okay. Sometimes in Zoom, the slides have a life of their own. And what they found in these pre-treated rats is, and they were getting a whopping dose of ALA, 20 milligram per kilogram. I do not suggest that much in humans. They did not have the damaging effects from the organophosphates that they would otherwise have had if they weren't treated with ALA. You know, the controls didn't get treated with ALA and ended up with massive liver and kidney damage. Vitamin D is also crucial in organophosphate exposure to get levels up to 50 to 80. Okay, next. So docosahexaenoic acid, otherwise known as DHA, the part of fish oil that we tend to, not pay so much attention to. It's crucial in organophosphate exposure. It has been shown to protect against both organophosphate and carbamate pesticide damage. And the suggested human dose is 750 milligrams per day. Ascorbate, otherwise known as good old vitamin C, functions as an electron donor, and especially in mitochondrial damage, those electron donors are crucial to restore ATP. It also is crucial in regenerating glutathione. so that you can take your oxidized glutathione, turn it back into reduced glutathione and use it for detoxification. And of course, 3,000 milligrams or 3 grams is a minimal dosage. Tolerance testing usually shows need for greater dosage. Go ahead. Vitamin E, same thing. Critical antioxidant, regenerates glutathione, very important for dealing with organophosphate and carbamate damage. Vitamin E is very important for repairing both not only tissue and lipid-based cell membranes, but also in the nervous system. And of course, this is the complex, not tocopherol by itself, not tocotrienol by itself, but the combination of gamma, delta, and alpha tocopherol and tocotrienol. Carotenoids are also important. I'm sure all of you out there who are ranchers know that every year cows get a shot of 1.5 million units of vitamin A to prevent them from dying from organophosphate poisoning, because their feed, is conventionally grown and it has residual organophosphates in it, and cows get sick from organophosphate exposure. So, another way to do that is to feed them organic food, but the way that conventional agriculture does it is to give them a big shot of vitamin A. So there are a lot of toxicants that decrease the vitamin A that we're able to store in our liver. Organophosphates are one of those toxicants. There are a lot of things that decrease vitamin A stores in the body. Alcohol and coffee, just for 2 great examples, as well as sugar and tobacco, vitamin D deficiency and zinc deficiency. So those who are exposed to organophosphates are even more at risk for becoming literally vitamin A deficient. Of course, carotenoids can be used as pro-vitamin A supplements, except if you're a diabetic or you're a smoker. You can't use carotenoids, but otherwise they're great for vitamin A repletion. For the solvent exposure, sauna is the par excellence intervention. Works better than anything else. Just check and make sure that your airline personnel, and I'm talking specifically because of the ones that I've seen, the sick airline personnel, check them for cortisol and aldosterone. And if they're really hypocortisolemic and they don't have sufficient aldosterone levels, you don't want to put them in the sauna because they might lose consciousness. In addition, sulforaphane, taurine, glycine, and N-acetylcysteine are used to treat solvent exposure to improve solvent depuration. Remember that solvents can get stored in the body. We don't store organophosphates. They get detoxified and eliminated, but solvents can be stored in the fat. Oh, Kevin, you're here. It's so great. I really want to hear from Kevin. Please repeat that. Dr. Kevin Wand is here. That's great. Okay, next.
All right, so you're wondering what's going on with the government, perhaps. Well, 2 senators in 2019 introduced the Cabin Air Safety Act bill in order to require planes to have sensors for carbon monoxide, get some training and resources for pilots and flight attendants, and to order the FAA to better record and monitor fume events, criticizing the FAA's inaction. And they said all too often on health and safety issues over the years, the FAA has been partial to the industry's interests over the public interest. And they were aiming for the bill to mandate thorough investigation into cabin air quality reports. I have some details here about equipment news, but as it turns out, it doesn't really seem to have moved the needle. My monitoring of changes in this regard don't seem to be anything to report on. The only thing noteworthy is that EasyJet wanting to develop a new cabin air filtration system really marked the industry's first acknowledgement of aerotoxic syndrome. So I guess that's worth something. And Boeing has a equipment, the 787 Dreamliner, that they chose not to use bleed air to supply oxygen to cabins, and there haven't been any fume events on those. There was some congressional inquiry, JetBlue finding itself in hot water. instead of, I guess, hot fumes, because over the course of a year, there were so many severe fume events that Congress believed it was a serious threat to safety of passengers and crew members, and they called them to task for describing what they feel was an attempt to reclassify fume events as odor events in order to avoid standards that are required in compensatory laws. There has been some successful lawsuits and litigation. Britain's union is pursuing hundreds of cases involving 8 different airlines, and all of this is helping to create more awareness around what's really going on up in the skies and even on the ground. So here's some clinical resources to complement what Lynn has already shared. If you are working in this field, or you might feel that someone has walked through your doors that you're wondering whether this could be a person who might have had organophosphate exposure and these other toxicants through travel, whether they were a frequent flyer or they may be a pilot or a flight crew. Some resources to learn more. And finally, these are documentary films that have been produced around this topic, largely by people involved with the flight industry, but also BBCs. Thank you so much.
Thank you, Cathy, and thank you, Dr. Patrick, for this excellent, excellent presentation. I learned so much, as I'm sure everyone else on the webinar did. This is such important information. So for those of you who are on this webinar, please make sure to share this with your colleagues, because that's, I think, one thing that we really don't ask when we are seeing our patients or our clients is, you know, how much they travel. And especially if they have a chronic illness, if, you know, this has contributed to their chronic illness. So such important information. Thank you so much. And I learned that organophosphates really deplete vitamin A stores in the body, which I was not aware of. So thank you for that piece of information as well. I have so many questions, but I am going to go to our Q&A panel first, because we're already at 6:03 and I really do want to get to the questions for the folks that are on this webinar today. So let's see here. We have a question from Connor Waters. I hope I'm pronouncing that correctly. Which agency says to find other methods than pyrethroids to prevent bugs on incoming flights?
So Beth, I think that's a question for me. Is it what else can one do, or what else is the industry trying to do? I'm just not sure what the question is about, because honestly, this is really about the airline industry. These are international regulations. You can't get around them. There's no way that you can avoid them. If you are leaving on a flight from certain African countries and certain Southeast Asian countries, you can't avoid being sprayed. So it's not voluntary. Does that answer the question?
Well, and maybe there, you know, his question was more about, like, you know, or is there some kind of agency that could be tasked with finding other methods to prevent bugs? You know, so that I'm not really sure.
That's unfortunately above my pay grade, that question. I don't know.
That's a tough one. And Connor also says, which IVs for detoxifying organophosphates?
So that the standard nutritional IV that we call a Myers IV, which is composed of magnesium, vitamin C, and B complex vitamins, is the standard IV that Dr. McCarter uses and the standard IV that I was referring to.
Okay, great. Thank you. Bonnie Nedrow, the current president of the National Association for Environmental Medicine, asked, can you sort out the risk for passengers? Clearly those who work in the, you know, obviously in the air are a significant risk. Those who have SNPs also are clearly at risk too. What about others? And it's funny, Bonnie, that you asked that, because I also was thinking about that. you can look at the PON1 SNP, obviously,
Mhm.
and if you have SNPs there, you might want to consider how much you fly. But then the question is, well, let's say we're all an environmentally conscious group, right? And the less we fly, the better for the environment. But sometimes we have to fly for a conference, for work, to see family. And if you do have SNPs, and maybe you can speak to maybe other SNPs besides PON1,
Mhm.
then there's really no way to know if you're going to be exposed to a fume event. It's really just a risk, right?
Right. Right. Well, I think there are two parts to that question. The first one is the SNP part. So PON1 has been investigated. We've actually had speakers at the Environmental Health Symposium talking about their PON1 research. And this is a group from the University of Washington, and they've found, it's pretty exciting actually, that if you take an individual, a human with a PON1 SNP, and you give them high levels of polyphenols, like pomegranate polyphenols, for example, you'll increase the activity of their PON1 enzyme, even if they have a SNP. It's been known for so long that people with PON1 are super sensitive and at risk for organophosphate poisoning, that there are several teams of researchers all over the country, all over the world, actually, looking at what we can do to support people with PON1 SNPs. So I've talked about this in some of my pesticide lectures that are archived, but there is a whole list of things that you can do. But I think some of the best evidence is something like pomegranate polyphenols. Sulforaphane is another.
Mhm.
So the second part of that is, can we protect ourselves from fume events? Certainly, there's nothing, it is not against the law or any FAA regulations to take a gas mask with you on an airplane, right? Or an N95 or a respirator. And it will be more effective than a personal air filtration device. So they're small devices. They're about 3 or 4 inches high. I should have brought mine, that actually emit ozone and allow particulate matter. They're used both for viruses and bacteria and for toxicants to fall away from the face, basically. Unfortunately, because some of them have lithium batteries in them, they're not allowed on airplanes. So it is more difficult. And I've actually had mine taken away on airplanes and of course given back to me at the end of the flight, but there are regulations on American Airlines and United that prevent passengers from actually turning them on and using them. So it makes sense to me to have an effective filtration device with you on an airplane. And now these days, everybody has something over covering their face, so it's not a big deal at all. When we stop wearing masks, then it might become a little more problematic, but it's certainly okay to do that, to wear an N95 on your face. Now, of course, an N95 is not going to protect you from the solvent exposure, and we don't have any evidence that it's going to prevent you from TCP, but a cartridge respirator will do that. So I'm talking about the kinds of masks that are used by welders or people who work in industries where they're exposed to solvents. I have one that I use when I'm, doing stuff at home where I don't want to expose myself to fumes. And I do take it with me when I travel. And I know that sounds kind of crazy, but I think that we're just in this place that until the airline industry gets their act together, we have to take precautionary measures.
Absolutely. I think that if you have the PON1 SNP, perhaps a good idea is to load up on pomegranate extract before, during, and after the flight, just in case.
Absolutely.
Yeah.
Absolutely.
Since we can't carry pomegranate juice with us, no liquids, right?
It
So,
is
okay.
available in a powder, actually.
Yeah. Okay.
You can get it
Awesome.
in a powder, yeah.
Yeah. Let's see. I don't see any other questions. Are there any last comments, Cathy or Lynn?
Well, I want to thank Cathy so much. The huge bulk of the work for this webinar was her. She did just an unbelievable amount of research putting all of this together. And I just threw a couple slides together looking at a little bit of the toxicology of some of these toxicants. So I really think all of the compliments go to her for this webinar. It really was an incredible job.
I agree. You both, it was so informative. Thank you so much. And I just really want to encourage the attendees to, refer this webinar to your colleagues. I think it's so important that this information gets out there amongst us. You can send your colleagues to our website, which is envmedicine.com. So again, just send your folks over there. So it's envmedicine.com, and they can just click on the webinar section, and all of our webinars are archived and recorded, so they'll have access to it there.
And I'd like to jump in before we wrap up. I just wanted to say what an honor it was to do a webinar with you, Ms. Lynn Patrick, and how much you brought to this with your incredible exponential depth of knowledge around these environmental issues, because it is complicated and it really is important to understand how, why, in order to know what to do to support. And thank you so much. And I'm glad we had this opportunity to bring attention to this so that people can be more aware of what they might be experiencing and know how to protect themselves.
Yeah, the honor is all mine, actually, Cathy, but you're welcome. It is great. And I think at some point we actually may be able to present a case of a airline crew member so that we can really dial this in. I think that would be great.
That would be wonderful. Well, thank you again.
Thank you, Beth.
Very much. And thank you everyone for joining us tonight. Have a great evening, and we will see you next time.